Improving access to quality healthcare remains a serious problem for India's government. It provides state-run hospitals for the Indian public, but many complain that these facilities are often inadequate. A number of private companies are entering the sector to supply high-standard healthcare facilities to those who can afford it. Apollo Hospitals is one of the largest private chain of hospitals in the country, and Sameer Hashmi caught up with its founder, Dr. Prathap Reddy, in Chennai.
You were the pioneer when it comes to corporate healthcare in India. You were probably the first one to set it up in this country. How challenging was it? Because at that point of time, there were no private hospitals as such.
I think it was very clear. A corporate hospital is here to define two things. Our responsibility to the patient is first, but we have an equal responsibility for people who have invested with us. So we need investment first for sustain and grow. And this is what I think a corporate philosophy have introduced. And we were able to bring a very nice discipline, which is the best of both worlds as far as the investor is concerned, more importantly, as the patient and the relative is concerned. We do several wonderful things to keep patients happy, not only make their care continuously improvement, but also to see that this. And more important, I think, is our focus is on the other side, because we need the investor's happiness. We need his confidence. We need him to be happy, because for us to grow, we need more and more capital.
Still, there's a huge population out there in the country which still doesn't have access to basic healthcare. So you think a similar model is needed, or say a partnership between government and private players that could really address that section of the society?
I think to address the real health situation in India and most of the countries, like developing underdeveloped worlds, I think we need to develop a PPP model. The public, the private, and the patient. People's model, PPP, is needed so that we work out a model from bottom up. We can't find a solution from top and run it down. It won't work.
If you look at the Indian medical market right now, it's $66 billion US. 70% of the contribution comes from private players like you. 30% comes from the government. So is this the way ahead? Private players are going to really change the way healthcare functions in this country?
I think there are two things for this. Number one, I think the government spends only 1% of the GDP towards healthcare. We need to, whereas US spends 15 to 16% or more. And the Europe spends close to 8 to 10% of GDP. Even countries like Russia, Brazil, they all spend 3 to 5% of GDP towards healthcare. I think that's one answer. In the second, in this 12th plan, they have increased substantially. That is from 1% they're attempting to have 2% of GDP spent on healthcare. Even then, I think we're still going to find a big gap between people. And there is another thing which is coming up, what's called the universal health insurance. All of these products will shift a little bit burden out of the individual.
Last question on cost, because that's the key, as you said, to really address this issue, make it more affordable. How can the government and private players like you work on that front?
Working together will make a very big difference, because we can provide greater trust in what we're doing. What we need is to train more people. In India, we need to double our doctors from 0.8 million to 1.5 million. We need to triple our nurses from 0.8 million to 2.5 million. All of these people who have made this big difference here, the technologists who are very highly advanced, we need them. But what is needed is to put behind the solutions which can be innovations, which can make a big difference in reducing the cost and improving the outcome. That innovations, I think, if we do it in India, what's right in India is rest for the world.